Hello, everybody.
Hello.
Welcome back to the Push Podcast.
Welcome.
I'm Meghan, OBGYN, clinical researcher.
And I'm Sydney. I'm a labor and delivery nurse and online content creator and educator in the birth world.
Sydney, as we sit here getting ready for this next episode, I'm realizing I think we're wearing the same scrubs that we wore in a different episode that we've filmed.
You're right. I think we are.
I think we're literally in the same
ones.
combination.
Yeah.
But I feel the need to preface, this is actually a different day than we filmed that one.
Completely different day. Actually, I think it's been a few weeks.
Sydney's mom, Sam, my cousin, who should come on this podcast at some point for the amount of times that we've referenced her, gave us a hard time for not changing out our scrubs enough. So I feel like I'm extra conscious of it.
I know.
Need to but set the record straight.
Mom, I brought a second pair of scrubs today because I knew we were filming more than one episode today. Yeah. So I changed. Okay. I did change my scrubs.
This is a different day. It's even a different time of day than when we filmed that episode where you were in pink and I was in green.
Yeah.
I also just have limited scrubs, I think, at this point that I really like. So
yes.
I am cycling.
We're working on getting you some more. Yeah, we are.
Exactly. All right. So Sydney, we are talking about a topic today that is very near to my heart because it's something that I have had to learn a lot about in my first year of motherhood.
Yeah.
Do you want to tell our listeners what we are going to be chatting about?
Breastfeeding.
So we
are going to dive into breastfeeding because it's also World Breastfeeding Week this week, which is so cool. We wanted to kind of talk about, I think everyone always hears online, breast is best, breast is best, breast is best. Like it's just in your face at all times. Mm-hmm. And we're going to actually unpack that and figure out, is breast really best?
Is breast really best, right? Because we hear conversely that no, fed is best, right? Mm-hmm. But then that has kind of become repurposed as a means to, or has been called out rather, sometimes I think as a means to not support mothers in breastfeeding journeys
as well.
Right?
Yep.
And a way to kind of excuse a lack of supports that are available and services available to parents who want to breastfeed, right?
Yeah.
So let's start, I guess, just by diving into kind of what the recommendations are right now and why they are like that in general from the perspective of our variety of different institutions and organizations that are responsible for maternal and child health.
Yeah.
And I have to caveat as well, I had to learn a lot of this myself as a mom.
Yeah.
When I was postpartum, because I think a lot of people assume that OBGYNs know a lot about breastfeeding. And I have to say, I know very basic information about breastfeeding from my education.
Yeah.
I know far more now from being a mom, from talking to other moms, other doctor moms, other non-doctor moms, lactation consultants, our pediatrician. Yeah. And so much of what I know about breastfeeding, I think, has been really gained in real time.
Yeah. Yeah. I was just going to say, I feel like you can almost speak on this more so from the perspective of just being a mom who's just gone through this, right?
Honestly,
it's funny because you think, oh, you're a doctor, you know everything, you know everything about breastfeeding, and especially because you work with pregnant moms, you would think you would, but it's a different specialty altogether, truly. And I have a huge respect for lactation consultants. After working in this field for 5 years, lactation consultants are angels sent from heaven, truly, sometimes. They're amazing. But yeah, there's a lot that goes into breastfeeding. And it's not just as simple as nature taking its course and being able to pop the baby on the boob and that's it, right? There's a lot more involved to it than just that.
Absolutely. And you know what? Lactation consultants, I'll second, are fantastic. But you know who the unsung heroes of breastfeeding are as well? Are postpartum and labor and delivery nurses. Yeah. Because they are really the women who taught me how to breastfeed. Yeah. And so I'm endlessly thankful to them.
Yeah.
And for like holding my hand through that process.
Yeah.
I used to, when we were on postpartum rounds as a resident, if patients asked me questions about breastfeeding, I would defer immediately to the nurses and say, oh, you should ask your postpartum nurses. We can refer you to a lactation consultant, no problem. And then I was in that room myself and went, oh, shit. Okay. Where's my nurse?
I need them.
Please help me.
Yes. Yeah. And that's why we're there, truly. Like we provide a lot of education and support in those first few hours postpartum as a labor and delivery nurse. And then you transfer onto your postpartum room, and then the postpartum nurses take over, and the lactation consultants and all that kind of stuff. But that's what we're there for. We're there to support you. And before we dive into this even more, I did want to kind of say that this is something I see a lot online is patients being worried that if they don't want to breastfeed, or they feel strongly about just bottle feeding or pumping and not necessarily breastfeeding, because that's just not something that feels right to them. They're worried to bring that up with their care team. I see that a lot. And I'm here to tell you that we don't care. Like what we care about is you and what is the best decision for you. So we're here to support you and hold your hand through whatever decision is best for you, your baby, and your family. So whether that is breastfeeding or formula feeding or exclusively pumping or none of the above, we will guide you and help you, and we will not do it with any judgment.
No.
Yeah.
Absolutely. While we're on the topic of caveats, before I get back into talking about the recommendations, which I know I kind of started talking about and then rerouted briefly.
Sorry, that's my bad.
No, mine too. Geez, this is welcome to the Push podcast.
Yeah,
where
truly,
Sydney
we're all
and Meghan
over the place. We try to follow
several
a schedule
side paths to every conversation
all the time, but that's us in real life too.
It is 100% us in real life. But I do want to clarify as well, in this topic review, we may be using the term breastfeeding frequently to signify really the provision of human milk.
Yeah.
But I think that also is important. Like a lot of the studies that we may be delving into don't necessarily differentiate between milk that comes from a breast or milk that comes from a bottle or other device, right? And that this will really be focused on the infant and maternal benefits of human milk, of the complications and barriers to that, of all the alternatives, regardless of the lactating individual's gender as well, right? Identity, family structure, and other social contexts. So we recognize that there are other terms like chest feeding that are also used to denote the same thing. And again, that much of the data that we're going to discuss does not necessarily differentiate between parents who are exclusively pumping, for instance, and giving that milk to baby, as opposed to delivering it directly from the breast.
Yeah. And just to quickly touch on chest feeding as well, if the term breastfeeding doesn't necessarily fit with you and your journey, you can also completely tell your care team that, and we will change our language involved with breastfeeding, chest feeding, whatever suits you and whatever you're comfortable with. Just communicate that ahead of time, and that's something that we will absolutely incorporate into your care. So
absolutely.
Yeah.
Okay. So human milk is kind of the primary default source of nutrition for virtually all infants. And right now, there are many societies in the world that do recommend exclusive breastfeeding for the first 6 months of life, followed by continued breastfeeding with the introduction of appropriate complementary solids for at least the first year of life and beyond. And some of those societies include groups like the American Academy of Pediatrics, the American Academy of Family Physicians, ACOG, the College of Obstetricians and Gynecologists, the WHO, the Canadian Pediatric Society, and this is based on both data that supports the short and long-term benefits to both mother and child of breastfeeding. The WHO actually recommends continued breastfeeding at least through the child's second birthday, and the American Academy of Pediatrics supports continued breastfeeding as long as is mutually desired by mother and child for 2 years or beyond. So I think what's important to keep in mind with that as well is that is kind of the guideline, that is the recommendation right now. But these guidelines and recommendations are there to, I think, serve as a template and not a strict rule that everyone need follow by, because as we will discuss in this episode, there's a lot of factors that go into whether breastfeeding is right for your family, and some of the issues that may kind of fall into place.
Absolutely. Yeah.
So human milk is a living biological substance that really is much more complex than just the parts that are involved in it in and of itself, the nutritional components. And part of that is because it doesn't just contain macro and micronutrients, which would be easy for us to replicate and which we have replicated very consistently in formula, but it also contains living cells, growth factors, and immunoprotective substances.
Yeah.
And because of that, there are numerous benefits to baby with human milk that cover areas like immunity, growth, and brain development. This includes improved protection in the short term from things like infection, improved gastrointestinal function, as well as, interestingly, neurobehavioral benefits. Although what I found interesting when I was reading up about that was that although it appears that breastfeeding may have some direct neurobehavioral benefits, the mechanisms aren't super established. And what actually might be more key there is skin-to-skin contact with mom during human milk feeding itself.
Yeah.
So early skin-to-skin contact between parents and newborns has shown to have some short-term neurobehavioral benefits.
Skin to skin is magical.
Exactly. It reduces infant crying. It increases blood glucose levels and promotes greater cardiorespiratory stability in late preterm infants as well. So this is really in like the immediate postpartum period.
Yeah.
But certainly I know that I was recommended to reintroduce skin to skin throughout the newborn period. Anytime my son was fussy or we were having difficulty, kind of offering him comfort as kind of a reset to baseline.
Yeah.
And so it's, outside of the actual feeding component itself, it seems like that closeness, that touch, that
it's
contact,
more important in a way.
Yeah, exactly. Now, there was also a brand new systematic review published in the journal Pediatrics, which is the official journal of the American Academy of Pediatrics, just like a month and a half ago in June of 2025. This is by Pat Noda et al. Sorry if I'm mispronouncing that name. And it's a research team out of Kaiser Permanente in Oregon. Is it Kaiser Permanente or Kaiser Permanent?
I have no idea.
Canadians here. Sorry, guys. I know this is a big center in the U.S.
I'm not sure.
I've seen lots of research come out of them. I probably shouldn't be admitting for the first time on the podcast that I don't actually know how to pronounce it.
It's okay. I think our listeners will.
I feel like Google could have answered this question for me before we got started, but here we are.
This is real
team.
Life. We are human.
Here we are. So what I thought was interesting about this study is that, again, although we know that there is lots of benefits for baby, there's good evidence for decreased infections, even outside of that initial period throughout kind of infancy. There wasn't a whole lot of data to suggest whether there was any kind of impact on like whether or not breastfeeding was exclusively done or not, right? The duration of breastfeeding, the mode of feeding, right? Bottle feeding versus direct breastfeeding. And the source of breast milk, right? Does it matter if it's donor milk or does it matter if it is from the biological mother of the child?
I was just going to say donor milk is used a lot in the NICU too, right? Like we see that a lot with preterm infants and babies who are, who do have to go to the NICU for whatever reason, that we do use a lot of donor milk because of all the benefits that you stated previously, the immunity, growth, brain development, all that kind of stuff. It has so many benefits for babies, especially preterm or sick infants. Anyway, sorry, just a tangent.
No. So breastfeeding has been studied really well or studied a lot, I should say. And this systematic review actually pulled from other systematic reviews as well to really try and increase the reach and the information that they were able to glean. Now, Unfortunately, there were no specific outcomes in which they were able to actually tell us, is there a particular duration or intensity of breastfeeding that is more or less helpful? And where potential benefits or associations were seen, more versus less breastfeeding was generally the conclusion. So there does seem to be some like dose specific effect. But some of the really good outcomes that they were able to find, where there is some good data for, is reducing things like ear infections in children, reducing risk of asthma, obesity, long-term risk of cancer, as well as like more short-term effects, things like respiratory infections, diarrhea, allergic rhinitis, so colds, inflammatory bowel disease, type 1 diabetes, cardiovascular disease, and there is an association between breastfeeding and reduction of sudden or unexplained infant death syndromes.
SIDS.
Exactly. There is a strong association or a moderate association as well with things like good weight gain and growth in that period as well.
Interesting.
So there's lots of clear benefits to breastfeeding.
Yeah.
I think the things that we still don't know are some of these elements that really get into the actual experience of it itself, right?
Exactly. Yeah.
How much, how long, from where, right? And how much does that impact things? So hopefully we'll be able to answer those questions in a little bit more detail, but I think in the years to come. But I think for the time being, what is important, I think, for us to consider for people who do want to breastfeed, right, is that breast milk in some quantity does provide benefit.
Yes.
Right.
And especially the colostrum too, right?
Yeah.
So that's that, liquid gold that you hear about online that people talk about all the time. But that's that first initial milk that your body produces. And it's usually thick and almost like honey. And it's usually a darker yellow, almost orange color. And that's that learning milk that baby learns how to digest and drink with. It usually lasts a few days postpartum, and then it switches to the larger volume quantities of breast milk. But usually that colostrum is a very nutrient dense and caloric dense as well. So the baby doesn't need large volumes of the breast milk at that time because the colostrum is so nutrient dense. So sometimes what I say to patients is if you're breastfeeding isn't really something that you're interested in doing, you can always harvest the colostrum, or at least try feeding baby the colostrum, which can have some benefits as well. So that's an option too to think about. Yeah,
absolutely. Now for us moms, there is also some benefit for breastfeeding for us too.
Right.
Immediately in the postpartum period, putting baby to breast does help to initiate the release of oxytocin from our brain. Now, oxytocin is involved in milk production / letdown.
Yes.
But it also helps with postpartum blood loss by initiating contractions in the uterus.
Yeah.
And so this helps to reduce the risk of postpartum hemorrhage and bleeding. It also provides in the postpartum period a delay in resumption of ovulation. So it kind of prevents you from ovulating and acts as like a natural contraception. However, guys,
everyone's going to say now, wait, if I'm breastfeeding, I can't get pregnant.
No, you can get pregnant. It does prevent ovulation, but it is impossible for us to know when you are going to start ovulating again. Yes. And that is why it is not a reliable form of contraception for many people.
Yeah.
In an era where we have much more reliable contraception.
Yes.
If you want to use breastfeeding as your contraceptive of choice, that is totally your prerogative. And I am totally supportive of that. But I do tell my patients, you will resume ovulation eventually. And it is just hard for us to know. I have many patients, I have many friends who exclusively breastfed and started their period long before they started weaning. Right? For what seems like no reason at all, right? Just because that's the way that their body wanted to do things.
Which is cruel, truly, but
It is deeply unfair. And I'm sure those women feel the same. But that is my caveat. Sorry, I got really excited there for a second.
No, but it's something that people need to know.
It is not
the amount of second babies that come in and they're like, well, we didn't think we could get pregnant because we were breastfeeding.
If you would welcome a second baby, that's totally fine. And again, if it's your preferred method of birth control, it's also totally fine, right? Like
just know that it's not
your prerogative.
It's not 100%.
You will ovulate eventually again, and you may not get a warning shot. So you may just get pregnant. And
if you're okay with that, then you're okay with that. But if you're not okay with that, use a backup. Use a backup method.
In the long run, breastfeeding's also been shown to decrease the risk of breast, ovarian, and endometrial cancer, so cancer of the uterus.
Wow.
And it also appears to have some long-term cardioprotective effects against cardiovascular disease. And the thought is maybe because it accelerates the postpartum transition back to the non-pregnant metabolic state, which is ultimately kind of better for our bodies in the long term.
Yeah.
It also, lactation is associated with improved glucose tolerance and insulin sensitivity over time. So decreasing your chance of long-term development of type 2 diabetes.
Interesting.
Now, there are some areas where there is no clear benefit of breastfeeding, which has been previously postulated, or there is kind of conflicting evidence. Development of osteoporosis would be one of those. So certainly, your bone mineral density decreases when you're breastfeeding. And that's because skeletal calcium in our bones is the main source of calcium for breast milk production. Right. However, and so we do have bone mineral density loss during breastfeeding. However, bone mineral density is typically restored to normal baseline levels post-weaning. And that's been shown in a number of studies. Some studies have also shown an association between shorter breastfeeding duration or exclusive breastfeeding and risk of postpartum depression. But again, it's some conflicting evidence, and causal determination has not really been assessed yet.
Right. Because I know for some women, probably breastfeeding can be contributing to your postpartum depression as well, right?
Yeah,
so it's hard to say. Yeah.
Now, the last thing that I would say is that there is a familial benefit and an economic benefit with breastfeeding as well, right?
Yeah.
In that, formula is really expensive.
So expensive.
I found a statistic that says that the average for one infant in the United States, a family may spend $1,200 to $2,000 on formula, which honestly, if anything, feels like a low estimate to me. Formula is really expensive.
Yeah.
And in a global analysis, the cost of formula was estimated to be an average of 6.1% of a household's wages, which is crazy, right? And that obviously represents a higher proportion in low-income households.
Oh, yeah.
And so breastfeeding can be cost-saving from that perspective as well.
Absolutely.
Now, as like a kind of joke side to that, I certainly have heard many times circulated on social media that the savings you get from breastfeeding, at least in like middle or higher income households, are then spent on online shopping as you're rocking in the middle of the night trying to stay awake while you breastfeed your infant.
Yep.
And so I cannot confirm or deny whether that is true. But certainly there are flip sides. There are costs and benefits associated, both economically and with all of them.
And I would also argue the dishes too, right? Like less bottle washing and sterilization that needs to occur if you are exclusively completely breastfeeding, right?
I can't understate how much washing bottles and pump parts specifically.
Oh yeah, the pump parts are so small.
Batty postpartum, absolutely.
Did you ever use those sterilization bags that you put in the microwave?
So we have a sterilizer. We have a like sterilizer that I can put them in.
That you just use that instead, yeah.
When Sam was small, we used them.
Right.
When he was a newborn, we used the sterilizer. But since then, we've kind of moved away to just washing with hot water and soap, like anything else. Now that I have a baby that walks around and tries to actively eat shoes and dirt and rocks and things like that,
it doesn't matter as much.
No. But speaking of Sam, and I'm glad that you brought up colostrum in particular.
Yeah.
Because as an anecdote for my own breastfeeding journey, although I had, again, a relatively smooth breastfeeding experience, and my production wasn't a problem, I had a very hungry boy. And I'll never forget our first night. I delivered around noon. And so we had a perfect angel until midnight struck that first night. And the first night, like we say in labor and delivery, like, oh, the first night is free. They're usually still kind of sleepy and content and everyone is happy. And it's the second night that is challenging once you're home. For me, no. First night, he woke up at midnight screaming hungry. I tried to feed him all night long.
Yeah.
And our absolute angel postpartum nurse who came in sometime around 5 o'clock, as I was like sweating that I had broken my baby somehow and that like surely something must be wrong with him.
Yeah.
And also, am I waking up everybody else on the floor because he's screaming his lungs out? She came in and she very gently sat down beside me and she said, should I bring some formula in?
Yeah.
And I said, yes, please do. Yeah. And so we actually, although we eventually, within a few weeks, were exclusively breastfeeding, we supplemented with formula day one.
Yeah. And that's okay.
For my own baby. Yeah.
Yeah. And that happens to a lot of people because especially the bigger babies.
Especially
I noticed like
you've experienced that on postpartum?
Oh yeah. Like they're just hungry.
He was just hungry.
And sometimes they get so mad that they're just screaming their head off and they can't even focus on the breast because they're just screaming so much. And then as soon as you give them a little bit more in their tummy, that volume, they need that extra volume that the colostrum isn't always providing, right? And especially as a first-time mom, usually you don't have quite as much. Sometimes you do, but and then for them you probably noticed like once he had a little bit of formula, he was able to settle.
Oh, so much easier to settle. So much easier to settle.
Yep.
Yeah. And here's the thing, right? Like using formula is not always a choice.
Yeah.
For some patients and some families, some women, it is, right? And there's nothing wrong with choosing to use formula. But for many, it's not a choice, right? It can be a medical issue. There can be logistical problems, something mental health related, or again, a personal preference, right?
Yeah.
Some common reasons why people might need to use formula are low milk supply, right? Maternal illness or medications that need to be taken that are not compatible with breastfeeding. Babies who are unable to latch or transfer milk well, right? Parental burnout, postpartum depression and anxiety, and a need to return to work or needing feeding flexibility, right?
Yes, which we're blessed in Canada to have a longer maternity leave if we want it, but in a lot of places in the world, that's not the case either, right? So,
I can't imagine. I went back to work at full time at about 7 months, which is early in Canada, but I realized how lucky I was to be able to take that, right?
Yeah.
Compared to many of our colleagues across the world. And number one, I can't imagine going back earlier.
Yeah.
But number two, my supply tanked immediately. And I had a bit of an oversupply because of the aforementioned hungry boy.
Yeah.
But I immediately, no matter how much I pumped, and pumping was so hard at work.
Yeah.
I was a person who felt very comfortable breastfeeding anywhere, anytime, but not comfortable pumping in front of like patients, right? Or not to say that that would be wrong for providers who do, and I have certainly seen and would support that from my colleagues. It just wasn't something that I was felt comfortable with.
Yep.
And it was so hard going back to work.
I can't even imagine.
So hard. So once again, around 9 months, my freezer stash ran out and we began supplementing with formula again.
Yeah. Yeah. So it's very dependent, like with your story with, I think so many people can relate, but it ebbs and flows. It changes with your needs, with the baby's needs. And sometimes supplementation is not the enemy. It's not a bad thing. Formula is not the enemy.
No.
Sometimes it is very much so necessary. And in that case, I would say fed is best because you just ultimately need to make sure your baby is well nourished. And
well, this is the thing. We are so lucky in Canada and as well for our colleagues in the US, right? And I'm sure in many other places in the world, I just can't speak as easily to those systems, but all infant formulas sold in North America meet national regulatory standards, right? And that's Health Canada here.
Yep.
They have to contain proteins, carbs, and fats. They contain essential vitamins and minerals.
Yep.
The one thing that they may miss is some of the immunological components.
Yep.
But they're absolutely suitable for exclusive feeding or for supplementation, right?
Yeah.
They're designed to mimic breast milk's nutritional profile.
Yeah.
And so they're not identical, right?
Mm-hmm.
And again, there are demonstrated benefits to breastfeeding. But everything is on a balance of risk and benefits, right?
Exactly.
And for many families, the benefits to breastfeeding do not exceed the risks of doing that, right? Or the downsides to that for any number of reasons.
Yeah.
And that has to be the right choice, right? And that's why it is so individualized and why people should feel empowered to make the right decision for their family.
Yeah.
Right?
Yeah. And while we're talking about kind of the nutrients and everything that's actually found in formula, I wanted to kind of highlight too that women who do choose to exclusively breastfeed, they actually do need to supplement with vitamin D for baby. That is recommended.
Yep.
So, the D drops, I'm sure you
Baby
guys have heard them. But that's something that actually formula already has in there. So you don't need to supplement with the D drops. But with breastfeeding,
either maternally or for baby, because you
Yes.
can also supplement maternally
Yes.
instead of the D drops.
But it's just something to note as well while we're talking about the nutrients and everything found in formula and how safe it is too, though. It's there's no shame in formula.
No. And this is, again, I think what ultimately we should kind of come full circle with, I think, from this whole fed is best, breast is best.
Yes.
Like back and forth and clash is really like supported is best.
Yes.
Right?
Yeah.
Again, like I felt so lucky to have been so well supported at so many points in my breastfeeding journey.
Yeah.
And I still found it hard, right?
Yeah.
Pumping destroyed me. Like pumping, I mean, that is an exaggeration, I feel I must say, because I have so many friends who exclusively pumped or like pumped far more than me.
Yeah.
But it is so hard.
It's hard. There's so many parts to breastfeeding it's not just comes to you naturally.
Yeah.
And like, I know there's women who struggle with the undersupply. Like you said, when you went back to work, your supply tanked.
Yeah.
But there's also the other side of that, which is an oversupply,
can
which
also
can be
really hard for people.
One of my close friends, Labor Junkie RN, she talks about this all the time on her channel. You guys should go check it out. But she has, with every baby, she's had this immense oversupply, and it is wild.
Yeah, yeah.
And that can be so challenging too. I mean, she used it to donate and stuff like that, but it's a full-time job for sure. Breastfeeding is a lot. And then if you're making tons of milk, it can also be really challenging.
Yeah. I mean, listen, people with oversupply are often at risk of things like mastitis if they're not pumping efficiently or feeding efficiently. Or I shouldn't say efficiently, if they're not emptying frequently, right?
And
like enough
that engorgement
for their breast.
can be so painful.
Yeah. I don't know if we ever actually ended up mentioning this in any of our rollout, but the reason that we delayed our rollout by a week, we'd originally decided July 9th we were going to launch. And then the reason we moved it a week is because I got a wicked case of mastitis.
Awful mastitis.
Right beforehand and was just knocked right out by it. It was really humbling, actually.
Yeah.
I'd had some clogged ducts before and that was painful. But the mastitis, like I had the fever, the chill, like I felt super, super crummy and just was like not able to function that week.
When you get a fever as an adult, I feel like I literally texted her this, but I'm like, it's so bad. Like when you get a fever as an adult, you're just down for the count. Like you cannot do anything.
Yeah. Yeah.
But if that is you and you're suspecting that, talk to your doctor because obviously you needed antibiotics to
I sure did
to get rid of your mastitis, right?
Yes, I sure needed some antibiotics and I felt almost immediately a lot better.
Yeah.
But you know what? I think all this speaks to all of the different challenges that we've described is that there's a lot of pressure to find kind of the right path through this, right? And there's a lot of discourse and pressure, I think, from all sides to contribute to this overall sense of guilt and stress and strain facing new parents as to how to best feed their child, right?
Yeah.
What have you seen and experienced, Sydney, like working really on like the ground floor with patients at their first introduction to breastfeeding?
Yeah, I think for a lot of patients, they feel like it is going to just come naturally, and it's just something that you inherently just know how to do. And then they quickly are humbled and realize that is not the case.
Yeah.
Or they get frustrated. Like I find I'll come in and I'll pop baby on the breast.
Yeah.
Usually no problem. Like, I mean, sometimes it takes some time, but I can usually figure it out. And then I usually say, okay, next time, just like try yourself. And then if you're having issues, like, of course, call me, I'll come help you. And then they usually are discouraged because they couldn't figure out how to do it on their own right away. And that is so normal. It takes practice. It's learning for you, and it's also learning for the baby. And this is something also important to note, is that every baby is different too. So even if you've had one breastfeeding journey previously that went really well, and then all of a sudden your second baby, you're like, oh, like this is completely different. That happens too. So it's kind of one of those things like we keep mentioning, but everyone's path is different, and it's just taking it one step at a time. You can't necessarily have such a rigid plan. I say this with birth plans usually as well, but breastfeeding is encompassed in your feeding plan should be encompassed in your birth plan. And making sure that you're flexible is the number one thing I would say, because you truly don't know what your experience is going to be until you're doing it, until your baby's here and you're trying. And I think having an open mind is the best thing that you can possibly do.
Yeah. I agree. Yeah. And you know what? If things like breastfeeding can be wonderful, right? But it can also contribute to things like postpartum anxiety and depression, right? Yeah. Sleep deprivation and burnout. I certainly found that really hard, because when I was the only person who was able to feed our son, it meant that I was the one that was up constantly every few hours, and there's no amount, unless you're, fortunate enough to have a partner who can also lactate, right?
Yes.
Then it means that you are the birthing parent is often the one who is getting up for all of those nighttime feeds, and that can really exhaust a person very quickly. And also feelings of failure if things don't go the way that you had planned, right?
Yeah.
And ultimately, I think what any provider would agree with is that a regulated, happy, functioning parent is far more important than exclusive breastfeeding.
Yeah.
Because ultimately what your baby needs way more than your milk is you.
Yeah.
Right?
Yeah.
And I think even distinct from like all of these emotions that can come associated with breastfeeding and some of the challenges and struggles around breastfeeding, we're increasingly hearing about a condition called dysphoric milk ejection reflex, or DMER, that I feel like it's all over social media right now.
Oh, yeah.
My literature suggests that it's quite rare, but I do have to wonder, in the complexity of the postpartum experience, if we have missed catching this for some people, or how accurate our prevalence rates may actually be. So DMER, for anyone who is not familiar, is a condition that affects some lactating people. Basically, that causes a wave of negative emotions like sadness or anxiety or dread just before or during letdown or the milk ejection. And it's not postpartum depression. Yeah. It's characteristically, diagnostically distinct from postpartum depression, although of course it can occur alongside it, especially in the context of like the upheaval of the postpartum period, and then confusion about why you may be feeling this way when you're breastfeeding. Yeah. So key features to it are a sudden brief emotional drop that can last a few seconds to a few minutes, but I've seen described even longer depending on the length of the nursing session. Yeah. It happens with the letdown reflex, and it can happen even with pumping. Yeah. And again, emotions can include sadness and irritability, anxiety, hopelessness, sometimes feelings of shame even. And it's thought to be because of a dopamine dip that can happen with milk release in order to allow prolactin to rise. And so it's unclear to me at this time whether it is the depth of the dopamine release that is the problem, or if it's more of like a sensitivity to low dopamine. Yeah. That may be the issue. As in with many hormonal disorders, it's not actually so much about like levels of hormones themselves, but of like particular sensitivity to fluctuations. Yeah. But in any case, it may be dysregulated in some people, which triggers this dysphoria. And there's not super good management, I think, because we're really only beginning to understand it. But certainly education and validation, I think, are like number one, right?
I heard about this for the first time only a couple months ago. And I've been a labor and delivery nurse for 5 years.
Yeah.
I'm embarrassed to say that, but it was the first time I'd heard about it. And you want to know where I heard about it? It was on a podcast. It was someone talking about their experience. I believe I can't remember her first name. I'm so sorry, but I remember her Instagram. It's Meals She Eats. She was talking about her experience with
DMER.
With DMER, thank you. I was going to say Dimer, but it's DMER. And she said that she actually felt physically nauseated.
I've seen that as well.
When the milk ejected. Like she actually felt like she was like, sometimes she would like gag because she felt that sense of, and she also described it as a feeling of almost homesickness that she got every time she fed. It was very interesting to hear her take on it. And so then that kind of made me want to ask people their experiences about this. So I started asking colleagues who I knew had breastfed. I'm like, is that a thing that you start to feel like sadness or all these like sad feelings? And across the board, everyone I asked said, yeah, I did actually experience a little bit of that. Maybe not to that extent that it is considered, DMER, whatever the medical acronym is, but it's interesting because it seems to be actually something that's very common for women to experience.
Well, I think it's tough because unless you're given words to describe what you're feeling and the validation that it is abnormal, it would be hard, I think, to really contextualize it.
Yeah.
Or describe in such a way as to, prompt someone to characterize it as abnormal, right? Because again, the postpartum period is really complex, and there's a lot of feelings that any of us are experiencing at that time. And so I can totally appreciate why that is challenging.
Yeah, it's a whole emotional roller coaster. Okay, so let's talk about medications and breastfeeding, because I know this is something that a lot of people who choose to breastfeed might have questions about. I personally usually recommend an app, actually.
I love an
download. App. Yeah, I love an app, but it's called LactMed. So it's LACTMED, and it's from the National Library of Medicine, and it helps you be able to check if a medication is safe for breastfeeding. So you can actually just look it up. So let's say you have a cold and you're taking cold medication and you're not sure if you can continue to breastfeed. This will give you all the information you need. But while we have you here as well, let's get your take on that, on different medications that are safe and not safe to have.
Well, listen, I think the good news is that most medications are compatible with breastfeeding, right? Although many medications, I think even the majority, do diffuse in and out of breast milk through their concentration gradient with the maternal serum. The amount transferred is usually pretty small, and so unlikely to cause any issues for baby. I went to UpToDate, kind of one of our guideline or one of our encyclopedias, I suppose, for medical information that is, for what it's worth, only available to providers. So I don't, and by subscription, right? So I don't blame any patients who are not able to access this information, of course. But they did provide some really good guidelines, I think, for beginning to conceptualize whether a medication may be safe or not. And I think the thing to remember as well, of course, is always talk to your provider, right? About specific medications.
Yeah. Or a pharmacist as well can also be helpful.
Yeah. But general principles, I mean, number one, if the medication could otherwise be prescribed to the infant for a medical condition, it's usually safe to take while breastfeeding, right? The doses transferred via breast milk are so much lower than what we would give directly to somebody. However, the risk of medication toxicity in general with preterm and ill infants is much higher than with term infants and with those who are now over 6 months of age. And so time frame can also be important in kind of considering whether or not a medication may be safe to use. Breastfed infants are usually not affected by medications that have poor oral availability, such as insulin or heparin. And so those medications are usually quite safe to take. And some medications we actually recommend not taking, not so much because they are dangerous to infants, but because for a breastfeeding parent, they can decrease breast milk volume, right? So things like dopamine agonists, decongestants, and important for contraception is estrogens, right? And so usually alternative medications are recommended in that case, if possible, just to reduce the impact on milk production. Now, classes of drugs that are generally not compatible with breastfeeding include things like statins, amphetamines, and ergotamines, as well as most chemotherapy agents. Most analgesics, so just like over-the-counter pain medications, are safe to take while pregnancy. And even among those that are not over-the-counter, many are safe. Codeine and tramadol, though, should be avoided because they can suppress the infant's respiratory drive. And oxycodone is recommended to be used with caution, as is aspirin. Aspirin, though, is different from ibuprofen and Advil. Which I was just going to touch on quickly, that postpartum, like for our C-section patients, even our vaginal delivery patients, they're usually very concerned about the pain pills that we give them. So to which I would say we will not prescribe you something unsafe in hospital. And but by all means, fact check us, right? If you're not sure about your prescription. And controlling pain is important, right? To your success in breastfeeding, to your postpartum experience, to staving off things like the start of postpartum depression and anxiety, to sleep, right?
Can't take care of your baby if you're in pain.
Exactly. So
or yourself.
Treating your pain, although this, the second we become mothers, for many of us, our own health kind of becomes a secondary consideration. Is still in service of taking care of your baby appropriately.
Absolutely.
Now, questions I get asked very commonly, and something I feel very passionately about, is there is no need to discard breast milk after anesthesia. So I have had several patients who have been breastfeeding who I take to the OR for some other reason. And in the past, I think we used to tell patients that they had to pump it up after anesthesia. And I think there are probably still some providers that tell them that. But the truth is that the vast majority of anesthetics that are used are perfectly safe to use. And so the American Association of Anesthetists coined a great new phrase, which I have started telling my patients, which is we are canning pump and dump, and we are saying sleep and keep.
I love that. Sleep and keep, everyone. Sleep and keep.
And then the last thing I get questions about as well is imaging, right? If people are getting any kind of imaging. So breastfeed doesn't need to be interrupted. When you're getting contrast, if that contrast is iodinated or gadolinium based. But if you're using radiopharmaceuticals or radioactive medications, it may be necessary to interrupt breastfeeding temporarily.
That's so interesting, because I think I've seen it a lot where patients are, put to sleep for surgeries and then they wake up and they're like, I don't know, can I specifically for C-sections, if they're being put to sleep, and we always let them breastfeed after. Always.
Absolutely. Now, Sydney, while I'm all fired up and on a soapbox, can I take a step up to another soapbox?
Absolutely.
About another issue that I feel like is not well communicated about in breastfeeding. I
have a feeling I already know what this is.
Do you know what this is?
To me about it.
I have. So alcohol use in pregnancy, I think, is something where there's a lot of misinformation and discussion kind of floating around. And I think that the old recommendations used to be to avoid breastfeeding or even to pump and dump for 2 hours after a single serving of alcohol. And that would be because that would be the time that we would expect it to take in order to leave the system. Now, some of the guidelines that are referencing that data are based on fairly old studies. So although the physiology is correct, I think that the breast milk dissipates in around that time, or the alcohol content of the breast milk dissipates around that time frame. I do think that we need to have a little bit more practical and nuanced of a look at why is that important and in what context. So occasional drinking with breastfeeding has not been shown to have any negative effects on breastfeeding babies. And what's important to understand, I think, is the relationship between blood alcohol content and your breast milk. So when you consume an alcoholic drink, that alcohol passes really quickly, actually, from your blood into your breast milk. And so the amount of alcohol in your breast milk is actually reflective of your blood alcohol content. Okay. Usually after consuming one drink, an average sized woman will have a blood alcohol content of about 0.01%. Now, for reference, the average 5-ounce glass of wine has 12% alcohol. The average 12-ounce beer has 5% alcohol, and a shot would have 40% alcohol. So if your baby feeds when your blood alcohol content is 0.01%, your baby will be drinking milk that has alcohol that is 0.01%, right? So again, there are plenty of people who would say that's still too much for my baby and that scares me, and that is totally fine and reasonable. But I think what's important to consider is that plain apple juice contains anywhere from 0.06 to 0.66% alcohol, depending on the brand.
Wow.
And we don't really blink about giving
Apple juice
to older babies and toddlers.
Not at all.
So the amount that we're talking about is very small. And what I have heard referenced frequently is in order to give your baby an alcoholic drink through your breast milk, you would have so much alcohol in your blood content that you would be dead. You would not be able to sustain that level of blood alcohol content. So by no means am I encouraging people to drink. And truly, again, I think the main tips for consuming alcohol with breastfeeding that I would really stand on are that if you are unable to care for your baby because you're not sober, a sober adult needs to be present, right?
Yeah.
Don't sleep in the same bed as your baby. So no bed sharing for 24 hours after you've consumed alcohol, because being inebriated or otherwise impaired is associated with an increased risk of suffocation and sudden infant death. And to eat food while you're drinking, because that can help to reduce the amount of alcohol that is absorbed by your body. Otherwise, again, I think that this hopefully will free people from the perspective that while they're breastfeeding, they can't have a glass of wine for, a fun event. Steve and I had our 1-year anniversary 3 days after we had Sam, and I had a glass of wine that night. And then breastfed my baby without any concern whatsoever. Certainly what I want people to not do is pump and dump, right? Especially if you're one of those people who is really fighting hard for every ounce of breast milk you're getting. Don't pump and dump. This does not speed up the time it takes for alcohol to leave your system. So time is all it takes.
Yeah, that's great. I love that you had a glass of wine 3 days.
I sure did.
I love it.
I deserved that glass of wine 3 days postpartum.
Absolutely. While we're talking about alcohol, let's also just quickly touch on marijuana. So I know that's something that's becoming increasingly popular in research, but it's still really not. There's not a lot of information on it, at least. But I think the general guidelines for marijuana is not to have, not to smoke or have edibles while you're breastfeeding, just because there's, again, limited research.
Yeah. It does take, my understanding of the research as well is that it takes much longer for THC to leave your breast milk than it does alcohol.
Yeah.
And again, we really have no safe data on the amount or the percentage, but there is some studies to suggest that infants exposed to THC may experience some delayed development. And okay. So THC would be one for now that we would not recommend.
We would not recommend, but you can have your glass of wine. That's okay.
Totally.
But we'll see. We'll see what studies show in the future. But yeah, it does accumulate in breast milk. So that one's a no-go.
Yeah.
All right, everyone. Well, I think that's everything for our World Breastfeeding Week episode.
Thank you so much for joining us.
We hope you learned some important, valuable information that you can take with you, whether you have already breastfed a baby, if you haven't, if you're pregnant, if you're trying to conceive, if you had a baby and you're wanting to, you didn't breastfeed with that one, but you want to with this one, or vice versa. We hope this gave you some good information.
Absolutely. Yeah. And I hope that it served to free us a little bit of the pressures and expectation and, unhelpful advice sometimes that circulates around breastfeeding.
Yeah.
And again, I'm gonna stand on this last soapbox one more time, which is that like breast is best and fed is best, but supported is superior. Right?
Support is best.
Yeah.
Okay. Supported. Whatever choice you make, we will not judge you as your healthcare team. If your healthcare team is judging you, you need to find a different healthcare team. But you just need to do what's best for you and your baby. Because as you've said previously, your baby just needs you. Truly, at the end of the day, they need you. And if breastfeeding is taking the you away from you, then that means it's not serving you anymore. And there are other options out there. So
absolutely. So listen, chime in, let us know your experiences, what helped, what didn't with breastfeeding. Did you feel supported?
Yeah.
Was back to work as surprisingly challenging for you as it was for me?
Yeah.
What made your supply drop? What made it go up? Let us know your tips and tricks. DM us on Instagram. You can comment on our TikToks, or you can email us at askthepushpod@gmail.com.
Yeah, we'd love to chat about it.
We'd love to chat about it, and we will see you next week.
Thanks, everyone. Bye.